I'm David. I'm 52 years old. I have a wife, Susan. I have 5 kids. I have fixing to be 9 grandkids. Music played a massive role in my life. I started at age 5 playing piano. My mom says that I loved music even before I was born. When she taught music class, she would have to sit in the back of the room because I kicked her belly so much. My symptoms started in my late 20s. My forehead got more boxy and pronounced. I started getting heavier. I started having some joint pain, a lot of headaches, and my hands got so big I couldn't put them between the black notes of the piano without hitting 3 notes. I started progressively being able to do fewer things that I enjoyed. I didn't have the energy to actually play with the kids or even go to ball games and stuff. You know, I would go and just be exhausted. I felt without a purpose. I had a breaking point. One morning, I hadn't slept good. I hurt all night. I woke up, my hands were just completely drawn up in pain. And mentally, I drew a line in the sand. I decided that day I was going to a doc in the box, an urgent care. I got in the room, the doctor come in. She said, "What's going on?" I said, "I'm in so much pain." And she's like, "Oh, honey, I can't prescribe you pain meds." I immediately said, "Great. So we need to figure out what's going on." And that started about a 6-month journey into figuring out that I had acromegaly. The medications that I tried before, I had the shot. It's horrendous. I dreaded it. The nurse that gave it to me dreaded giving it to me. Not only was it painful getting the shot, I was nauseated and sick for about 4 days after the shot. Then I was okay for about 20 days, and then my symptoms came back full force. After the shot, I went on a pill twice daily. The twice daily oral medication didn't work for me for a number of reasons. The first reason was just the inconsistent symptom control. The second reason, I never met the IGF-1 level that my doctor wanted me to be at. The third reason is the second pill. It was very hard for me to schedule in. When I first heard about Palsonify, the thing that really interested me was the once daily, because that seemed to me like it would really fit my lifestyle. I wake up, and before I start getting ready for my day, I take 2 pills. I wait an hour before I eat, and the rest of the day's mine. The symptoms that improved, joint pain, headaches. I never thought I'd be able to play piano again like I did. Having less joint pain means that I can use my music as a release after a hard day's work or after a hard time in life. I can play, so I can actually center myself and get away. Some days, if I've had a bad day, hey, I may still have to rest a little bit, but my normal day is I go home, I mow the grass, I help cook. My grandkids and my kids are happy they have their dad and their pop back. I want to do it all. I want to be there. Just what adventure comes, I want to be able to jump on that train and go.
What is Palsonify paltusotine? Palsonify is a prescription medicine used to treat adults with acromegaly, for whom surgery was not effective or surgery is not an option. It is not known if Palsonify is safe and effective in children. Important safety information. What should I tell my healthcare provider before taking Palsonify? Before taking Palsonify, tell your healthcare provider about all your medical conditions, including if you have gallbladder problems, have blood sugar control problems, low blood sugar or high blood sugar, have problems with low heart rate, are pregnant or plan to become pregnant, it is not known if Palsonify will harm your unborn baby, are breastfeeding or plan to breastfeed. It is not known if Palsonify passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby if you take Palsonify. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Palsonify may affect the way other medicines work, and other medicines may affect how Palsonify works. Especially tell your healthcare provider if you take any medicines that can slow the heart rate. Know the medicines you take. Keep a list of them to show your healthcare provider and pharmacist when you get a new medicine. What are the possible side effects of Palsonify? Palsonify may cause serious side effects, including gallbladder problems. Palsonify may cause problems with a gallbladder. Tell your healthcare provider if you have sudden pain in the upper right area of your stomach, abdomen, sudden pain in your right shoulder or between your shoulder blades, yellowing of your skin or the whites of your eyes, or pale stools. Blood sugar problems. Palsonify may change hormone levels, potentially causing either high blood sugar, hyperglycemia, including diabetes, or low blood sugar, hypoglycemia. Tell your healthcare provider if you have problems with high or low blood sugar. Your healthcare provider will check your blood sugar when you start taking Palsonify or when your dose is changed. Heart rate problems. Tell your healthcare provider if your heart is not beating normally. Thyroid problems. Palsonify may keep your thyroid from releasing thyroid hormones, leading to hypothyroidism. Your thyroid function may be checked periodically during your treatment with Palsonify. Fatty stools. Palsonify may cause your body to have problems with absorbing dietary fats. Tell your healthcare provider if you have any new or worsening symptoms, including fatty stools, changes in the color of your stools, loose stools, stomach, abdominal bloating, or weight loss. Low vitamin B12 levels in your blood. Your healthcare provider may check your vitamin B12 levels during treatment with Palsonify. The most common side effects of Palsonify include diarrhea, pain in your stomach, abdominal area, nausea and vomiting, decreased appetite, slow heart rate, bradycardia, high blood sugar levels, hyperglycemia, and irregular heartbeat, palpitations. These are not all the possible side effects of Palsonify. For more information, ask your healthcare provider or pharmacist. You are encouraged to report negative side effects to Crinetics Pharmaceuticals at 1-833-CRN-INFO, 1-833-276-4636, or FDA at 1-800-FDA-1088, or www.fda.gov/MedWatch. Please see full prescribing information, including patient information, at palsonify.com and talk to your doctor.